Hi, everybody. Thank you for joining for our next podcast. Today, I'm joined by Kevin Cleary, Associate Director and Engineering Professor at Children's National in Washington, D.C. And he's joined us today because he's the host of the next SMIT Congress 2025 in Washington. Hi, Kevin. Thanks for joining us today. How are you?
I'm very well. Thank you, Leon, for conducting this interview. I'm looking out over the city from the top floor of the hospital here, and I'm fortunate that my office has a very nice view of the city. So I'm looking forward to having
Amazing.
people come visit us in Washington, D.C. to for the meeting and, of course, to tour and enjoy the historic city of Washington, D.C.
That sounds amazing. I would love to be with you and look over the city of Washington. And I think some of us who are joining today might as well. So could you tell us some details about the Congress, where exactly it is hosted, for example, and for example, what key topics are going to be discussed there?
Yes, absolutely. First of all, the easy way is the website is now live. So if you go to schmidt2025.com, SMIT2025.com, you can see the site, and the meeting will be held October 10th and 11th, 2025, next year, just in a suburb just outside Washington, D.C., so within easy access to the city. And I think the theme this time is reimagining the future of surgery.
Okay.
So we're really taking a look at the new topics, and I think many of the general topics that we've also had in past conferences, robotics, AI, devices, innovation, will be prominent this year at Schmidt as well.
Amazing. AI, robotics, definitely the themes that are moving the physicians and engineers of today. And I've just looked at your website. It looks amazing. Got a new design, and the robot is facing me right now. Very good. Do you already have some speakers lined up or a agenda ready somebody could look into?
Yes, we do. So if you go to the program tab, you can see a draft program, and this is just kind of subject to change depending upon what abstracts come in. So you'll also see that the registration will open in January 1st, 2025, and also abstract submission will open then. But we basically plan a 2-day meeting, Friday and Saturday. And then on the Sunday following, we are going to have tours of our hospital. So the meeting
Mm,
site is in the suburbs about I would say 10 kilometers from the hospital as well, but a very nice conference center and hotel. So I would also make plans to stay for Sunday for the tours of the hospital, as well as some time before or after the meeting for sightseeing in Washington, D.C.
definitely. I think everybody should plan a little bit time, even especially if you're traveling from farther away. And let's get back to the hospital visit you just mentioned. That sounds really, really interesting. Is there a tour plan? Do you have a special part of the hospital we're going to see at the ISMIT conference?
Yes, yes, we will. So our hospital is a pediatric hospital, the major pediatric hospital for the Washington, D.C. metropolitan area, which actually has over 5 million people. So we have a large population of children that we serve, and we're a 300-bed hospital in hospital speak, so to talk. But our research institute is on the top floor of the hospital. So we have a surgical
Okay.
innovation center that we'll be able to tour, and you'll be able to see our laboratories. We're also going to plan some workshops and special events. So certainly, I would encourage people who want to host a workshop or special event to also reach out to me. My contact information is on the website, and those can be accommodated as well.
All right. Amazing that you give our guests the opportunity to even host a workshop themselves. I think that would be a tremendous offer. And you just started talking about your research institute, which is located on the top floor. As you said, amazing view over the city, but there's definitely more to it. What is your topics of research right now?
Yeah, so we were formed about 15 years ago when the hospital actually got a very large gift from United Arab Emirates. And the idea then was that medicine was becoming more and more dependent upon technology. And of
Hmm.
course, that's obviously only increased since then. So we are really a technology innovation institute. So we are focused with surgery, but we work with all the clinical departments of the hospital. We build new biomedical devices. We create mobile apps.
Wow.
Nowadays, of course, the hot topic is AI, and can we use it for big data? Can we do predictive analytics? Can we, help the physicians with their heavy workload with AI tools? So
Yeah.
all of those are topics that are studied and projects that are ongoing at our research institute.
Interesting. Amazing. And the topic of the SMIT 2025 is robotics and AI. Is that already a research field you're heavily invested at your institute?
Yes, absolutely. I would say, though, that the topic, of course, includes robotics and AI, but we're really saying the theme of SMIT 2025 is really the future of surgery.
Okay,
And we know that surgery is changing, and with the introduction of robotics and AI, the question also becomes, what is the role of the surgeon going forward, too? I would
definitely.
like to reassure our surgeon colleagues that we will not replace the surgeon. We will augment the surgeon. The patient will not want to hear from the machine about their surgery. The patient will still want to talk to the surgeon, but we can certainly imagine that during procedures such as tumor resection, where tumor margins are critical, having some sort of machine assistance to assist the surgeon with getting proper margins while sparing healthy tissue would be useful. And I think that will be one of the topics that we'll discuss at the conference, as well as the overall theme is how should robotics and AI be integrated, and how should they work with the surgeon in the future when we know the surgeon's role will most likely change?
Right. And I think those topics you just started talking on about robotics and technological support is definitely a theme many of our listeners are well versed in, as most of them are active in medicine and engineering. So that is definitely a very interesting topic for them to dive deeper in. And as you mentioned, there are many more topics, all in the broad field of the surgery of tomorrow. Is there the program you can see on the website that you have on Friday the on Friday and on Saturday the main event, and in the afternoon and the evening there are certain special events as I've just seen. Could you touch on them? What have you planned there?
Yes, for one, we certainly plan to have a large exhibit hall, as well as also a large poster exhibition. I think posters are a good way that anyone can come present their work. Sometimes people may or may not want to give a talk, but they can certainly come present a poster. But what we do plan to have is an exhibit poster area where we will have industry sponsors. As well as research groups who want to present. And then finally, we haven't shown it in the program yet, but we do have access to a separate breakout room where if there's
All
someone,
right.
again, who's interested in running a special session, I have a good colleague who now works at NVIDIA. I think we all know NVIDIA now with their
Definitely.
graphics chips and things. They're doing quite well, but they've expressed some interest in perhaps sponsoring a workshop at the conference. So I think we have to involve industry in this meeting because
Yeah,
industry will eventually be a driving force for deploying the technology that we want to use. Most of it may be in research labs, but at some point we'll want to move it to industry to benefit the patients.
definitely. It's amazing that you combine the practical and the theoretical side at this conference with an invitation of the industry, and especially with the possibility of the breakout sessions. Is there could you speak on who already is on the conference from the industry side?
Yes, we have received from Siemens Medical Solutions. I think most everyone will know Siemens as well, have
Yeah.
agreed to participate. I am negotiating with Medtronic right now,
Mhm.
trying to get Medtronic to show their robot. And then we have some local vendors. We have a small spin-off company from Johns Hopkins. By the way, Johns Hopkins University in Baltimore is only about an hour away by car too, which some people may want to consider either visiting the university or also Baltimore itself, in addition to Washington, D.C. And
Right.
there's a spinoff company called Clear Guide that develops the augmented reality guidance system for precision placement of instruments in a minimally
Interesting.
invasive manager. And they will be exhibiting at the conference.
And that would be a very interesting thing for many of us who are interested to see what technological advancements are already on the market. And for those people, maybe who do you think would the your conference be interesting to? Who would be your target group? Yeah,
Yeah, I think we have a very broad target group for this society. As you
yeah,
well know, having been there yourself to meetings, it's a very interdisciplinary meeting. And I
right,
think that's kind of one of the hallmarks of SMIT. Certainly, I think surgeons are our primary customers. I think the conference really was founded by surgeons. And
right,
of course, the clinical people are on the front lines of medicine, but certainly anyone working in research, anyone developing technology. I think for students who are interested in the field as well, we have a number of universities and engineering schools in the Washington, D.C. area. So I think we'll probably get a good student participation as well. But I would even pitch it broader and say that anyone who really is interested in the future of surgery and a little bit the future of medicine. One of my keynote speakers that I haven't put on yet is our former CEO of the hospital, who will talk about the practice of medicine and the changing medical front, and
right.
what is the role of technology as medicine moves forward in the 21st century.
Yeah, and that's really what I love about the SMIT conference is it's somewhat for everybody who's interested in the broad field of medicine, surgery, engineering, and from the students to the executives, everybody has a place at the conference and definitely interesting topics to listen to and interact with other ones. And I think that speaks also to the another important point for the conference. It's not about just getting information and having a hands-on meeting. It's about the networking and meeting like-minded people, like as you have experienced so often. Maybe you can talk about how was your experience on the past conferences and how do you want to reflect that on your coming up?
Yeah, I think once again, as you mentioned, Leon, this is really a driving force of Schmidt. We
Yeah.
all go to conferences and we listen to talks, but I don't think we want to go just to listen to a talk. If that was the case, we could listen online. The beauty
Right.
of going in person, and of course, now that after the pandemic, I think we all appreciate the fact to get together in person. And so I think what's really important is all the side conversations that go on at
Yeah,
this meeting. That the conference is not too large. It still was enough to have critical mass. I anticipate we'll have 200 to 300 participants, but it's not too large where you can't find participants. So if someone gives a talk, usually there's the opportunity to find them after the talk or during one of the
hmm,
breakout sessions. That you can go up and ask them. And I think this is particularly valuable for new people in the field to be able to network. Of course, all of us, if I can call myself a senior person in the field, which may be fair now, at least by my gray hair, the senior people certainly like to talk and catch up and things, but I think it's equally important for the junior people because this field is changing very rapidly. And I think the in-person exchange and the information that you get in what I'll call the hallway conversations is probably just
yeah,
as important as the information presented in the main sessions.
that's right. And it's definitely even easier to get into those conversations if you have a bit of coffee or some snacks to go with. And you also have a gala dinner, as I've seen, or some other activities in the evening. So something less related to medicine per se, but to the social aspect.
Yes, yes, I agree. I think the social aspects of Schmidt again have always been another strong point of the meeting too,
Right,
particularly because we have a very international audience from very diverse areas in many countries. So, what we are planning for the Friday evening is a gala dinner that will just be at the conference center to make it easy for people, and we're actually planning
right.
at this point to make it more of a buffet. So that people can walk around and
Okay.
network with different people and
Yeah.
really, we're have the organizing committee, which is helping me, has really stressed that we have to create ample opportunities for networking, so that people can really get the full benefit of attending the meeting.
Exactly. Amazing that you have a such a rigorous planning team behind you, and yeah, I'm looking forward to this amazing conference. And for we have stressed it again and again, but it's also a meeting that is important for young professionals or even students. And do you have a special offer for them for making it a bit easier to attend to the conference, as I've seen it, right?
Yes, I would say we have not finalized all the registration details yet, but I think, as
Okay.
you mentioned, we certainly will encourage students to come as well. And if anyone has a financial difficulty, they certainly can reach out to me directly. It's because I think the conference is all about participation. But I would agree, as you mentioned too. Again, I think for students, this is a nice opportunity, particularly for young engineering students who want to learn about what it would take to build a device for medical, or even for medical students who are interested in technology and want to know what their practice is like. So we
Yeah.
certainly encourage the young people to attend the conference and to fully participate as well.
Perfect. I think that's a great take-home message. So we've talked about the conference, about the agenda, about who it is for. It's for young students, but it's also for professionals in the engineering or in the medical sector. And apart from the very interesting topics you're covering on a theoretical basis, we're going to have a practical hands-on in the hospital. But also a very important part is the networking at the conference. Kevin, I'm amazed. I'm looking forward to visit you in Washington here from cloudy Germany.
Yeah,
But
thank
I
you.
think it's going to be an amazing opportunity to visit the USA in general or the area around Washington. Do you have a favorite place to recommend for somebody to visit?
Well, there are probably too many places for me to give a favorite place, but I can certainly say, as you might anticipate, Washington is a very international city.
Hmm.
Because of the fact that we have all the embassies here. So we certainly have cuisine from everywhere. But I would
Right.
say, as a favorite place, the museums downtown are all funded by the federal government and are actually all free. So we have the
Oh,
art
crazy.
museum, the history
Yeah.
museum, the technology museum. So I would certainly recommend someone take a few days, as well as visit our hospital. I'm wearing my hospital shirt. You can kind of see Children's National with
Yeah, you
Dr.
can.
Bear, Dr. Bear, our
Yeah.
logo. And so I think, again, I'm a little bit biased organizing the meeting, but I think this is an amazing opportunity for people to combine a trip to the conference, a visit to our hospital, and a visit to Washington, D.C., and perhaps even a side visit to Baltimore, Maryland, all in one trip.
Okay. Yeah, that sounds great. And I think that bias is very valid, and I think it's a positive one. So encourage everybody to visit the area and join us for the conference. If you're interested, just go to Smith or schmidt2025.com or ismit.org and follow us on all the socials. All right, everybody. See ya. See ya, Kevin.